Good day everyone, especially to our clinical instructor, Sir Reynald Isiha. I am Angelbert Esparagosa and today we will talk about ABG, which stands for Arterial Blood Gas. This is a test that helps us understand how well a person's lungs and body are working to keep a healthy balance between acid, base, and blood. Now let's proceed to our learning objectives. By the end of this lesson, you shall able to first understand why ABG is done, to know the normal value we expect to see, and last, how to read ABG result and identify acid-base imbalance. What is ABG? ABG measures how well the lungs are moving oxygen into the blood and removing carbon dioxide. It also shows if the blood is too acidic or too basic. The test is done by taking blood from an artery, usually at the wrist. As you can see, we have here the Allen's test. Before drawing blood from the artery, we do Allen test. This check if the hands has a good flow from the two different arteries. If both are working well, it's safe to take the sample. And by collecting the blood, a special syringe with a small amount of heparin is used. This prevents the blood from clotting. The sample is placed on ice to keep it fresh until testing. Like any procedure, there may be a risk such as pain, bleeding, or infection. These are the steps and procedure for ABG. First, expel the heparin through the needle. Insert the needle at 45 degrees. Observe flashback. Allow the syringe to self-fill. Remove the needle and apply immediately. Firm pressure. Engage needle safety guard. Remove the needle. Dispose of sharp immediately. Attach the cap to ABG syringe and label the sample. What can affect the ABG result? ABG result can be wrong if the sample is delayed, taken too soon after the procedure, contain air bubbles, or accidentally has blood from the vein instead of artery. This mistake can be changed oxygen, carbon dioxide, and pH reading. As you can see the normal ABG values, first is the pH. pH is equivalent of 7.35 to 7.45. The partial pressures of carbon dioxide is equivalent to 35 to 45 mmHg. And also the partial pressure of oxygen is equivalent of 80%. The HCO or the bicarbonate is equivalent of 22 to 26 milli-equivalent per liter, and the base excess deficit is positive 2 or negative 2 milli-equivalent per liter, and the oxygen saturation is 94% or higher. Think of these numbers as the reference guide to tell if the blood is in balance. We have the four main types of imbalances. First is the respiratory acidosis, too much carbon dioxide from breathing problem. Second, respiratory alkalosis, too little carbon dioxide from breathing too fast. And third, the metabolic acidosis, too little bicarbonate or too much acids in the body. And lastly, we have the metabolic alkalosis, too much bicarbonate or loss of acid like from vomiting. How to do ABG analysis incredibly quick and easy. Follow the following step. First, remember the normal value. Always start with knowing the normal range, without that you can tell what's wrong. Next step is look at the pH. Does it indicate presence of acidemia or alkalemia or normal pH? If the pH is below 7.35, the blood is acidic. If above 7.45, the blood is basic or alkaline. If between 7.35 to 7.45, it is normal. Now let's proceed to our step 3. Check the partial pressure of carbon dioxide or PaCO2. Partial pressure of carbon dioxide reflect the respiratory side. Carbon dioxide act like an acid in the body. High partial pressure of carbon dioxide means respiratory acidosis. Low partial pressure of carbon dioxide means respiratory alkalosis. Let's see the example here. The pH is 7.32 and the partial pressure of carbon dioxide is 50. This is the respiratory acidosis. Now let's proceed to our step 4. Check for the bicarbonate. Bicarbonate comes from the kidneys and acts like a base. Low bicarbonate equivalent of metabolic acidosis. High bicarbonate is equivalent of metabolic alkalosis. For example, pH is 7.48 and the bicarbonate is 28. It means metabolic alkalosis. Now let's proceed to step 5. Determine the primary acid-base disturbance. Think about Rome. Rome is quick way to remember respiratory opposite and metabolic equal. If the pH and the partial pressure of carbon dioxide move in opposite direction, it means respiratory problem. If the pH and the bicarbonate move in the same direction, means metabolic problem. We have here the example number 1. pH value is 7.48 and partial pressure of carbon dioxide value is 34 and the bicarbonate is equals to 26. pH is high, which means alkalosis, and the partial pressure of carbon dioxide is opposite to pH, which means respiratory. So the answer is respiratory alkalosis. Let's proceed to example number 2. pH value is 7.50 and partial pressure of carbon dioxide is 43 and the bicarbonate is 34. pH is high, which means alkalosis, and the bicarbonate is high, same as the pH, which means metabolic. So the answer is metabolic alkalosis. Example number 3. pH value is 7.32. Partial pressure of carbon dioxide is 57 and the bicarbonate is 30. So pH value is low, which means acidosis. The partial pressure of carbon dioxide is high, opposite to pH is respiratory, equals respiratory. And the bicarbonate is high, which means compensating. The answer is respiratory acidosis with partial compensation. Example number 4. pH value is 7.30. The partial pressure of carbon dioxide is 31. The bicarbonate is 19. pH value is low, which means acidosis. The bicarbonate is low, same as pH, which means metabolic. So the answer is metabolic acidosis. Last example, the pH value is 7.44. The partial pressure of carbon dioxide is 32 and the bicarbonate is 19. So pH value is normal or slightly alkaline. The bicarbonate is low, would cause acidosis, or lungs are compensating. Answer, fully compensated respiratory alkalosis. Step 6. Look at the degree of compensation. The lungs and kidney try to correct imbalance if the partial pressure of carbon dioxide and the bicarbonate move in the same direction. The body is compensating. If the pH is back to normal, it is full compensation. If the pH is still abnormal, it is partial compensation. If they move in opposite direction, it is no compensation. Compensation, example number 1, pH value is 7.50. Partial pressure of carbon dioxide is 32 and the bicarbonate is 26. So check the pH. So pH is 7.50 is higher than 7.45, which means alkalosis. And the partial pressure of carbon dioxide is low, below 35. pH and partial carbon dioxide are moving opposite, which means respiratory problems, so respiratory alkalosis. And for the bicarbonate is normal, 20 to 26 range, which means the kidney have not tried to adjust yet. If the kidney were compensating, the bicarbonate would be low to match the alkalosis. Since the pH is abnormal and there is no kidney change, the answer is uncompensated respiratory alkalosis. Now let's proceed to example number 2. pH value is 7.54, partial pressure of carbon dioxide is 60, and the bicarbonate is 32. So check the pH. pH is 7.54 is higher than 7.45, which means alkalosis. Partial pressure of carbon dioxide is high, above 45, which would normal cause acidosis. This doesn't match the pH change. The bicarbonate is high, same direction as pH, which means metabolic alkalosis. Lungs are holding on to carbon dioxide, or partial pressure of carbon dioxide is high. To try to make the blood more acidic, the balance the alkalosis. pH is still abnormal, so compensation is incomplete. So the answer is partially compensated metabolic alkalosis. Compensation example number 3. pH value is 7.30, partial pressure of carbon dioxide is 53, and the bicarbonate is equals 30. So step 1, check for the pH. 7.30 is below 7.35, which means the pH is acidosis. Step 2, using the Rome method, partial pressure of carbon dioxide is high, opposite direction from pH, which means respiratory acidosis. Step 3, for compensation. Bicarbonate is also high. The kidney are producing more bicarbonate, a base, to try to fix the acidosis. But pH is still below normal, so the correction is not complete. So the answer is partially compensated respiratory acidosis. Let's proceed to the last compensation example number 4. pH value is 7.37, partial pressure of carbon dioxide is 32, and the bicarbonate is equal to 19. So the step 1 is check for the pH. pH is 7.37 is within 7.35 to 7.45, which means normal. But notice is the closer to the acidic side. And step 2, using the Rome method, bicarbonate is low, below 22, same direction as an acidic shift, which means metabolic acidosis. For the step 3, for the compensation, partial pressure of carbon dioxide is also low, which means the lungs are blowing off the carbon dioxide or acid to raise the pH back to normal. Because the pH is now normal, the lungs have fully compensated for the kidney problem. So the answer is fully compensated metabolic acidosis. In summary, we should always remember the PRC method. P stand for pH, meaning decide if acidic or alkaline. R stand for room, meaning identify the respiratory or metabolic. C stand for compensation, meaning full, partial, or none. ABG interpretation may seem hard at first, but with the practice, it becomes quick and easy. Just remember, pH first, then Rome or respiratory opposite, metabolic equal, then check the compensation.